representative for the AWS National Med Student Committee, and I am also a rising fourth-year medical student who will be applying to residency this fall. So tonight's topic is definitely something that hits home for me personally. I had the privilege of helping organize this webinar with my amazing colleagues, Kayla Hicks and Amber Priester, who you will get to meet later on this evening. We also had a ton of support from the rest of the student committee, and I especially want to thank Cheryl Zog, Aber Shen, and Shan Lansing for all their help with this. We are so excited to have almost 500 students signed up to join us on Zoom this evening, and hopefully even more on our YouTube live stream. We just wanted to start off with covering a couple of housekeeping items before we really get started. So to start off with, for those of you joining us on Zoom this evening, we would appreciate if you could keep your mics and cameras turned off just to help us prevent any bandwidth issues and background noise. Also, we'd recommend you having your Zoom on speaker view so you're able to see all of our panelists as they answer our questions. As far as your questions go, please enter all of your questions in the chat throughout the evening. Amber is going to be monitoring the chat and compiling all those questions to answer at the end. Also, if there's anyone who has questions that they're not comfortable asking publicly to everyone, you can directly message Amber within the Zoom chat and send your question to her directly. For those of you on YouTube, you can put any questions in the comments. We do have people keeping an eye on that as well. And we just wanted to address early on that the focus of tonight's webinar is really how to write and compile a CV and personal statement once you've kind of already had your experiences done and just kind of the technical aspect of writing it. I know we have a lot of MS1s and 2s signed up who might have more questions about like what sort of things should I be doing to put on my CV. And so if you have those questions, please go ahead and put them in the chat. It's helpful for us to know the things that our members are looking for, but please just know if we don't answer those questions tonight, we're not ignoring you. It's just not really the focus of tonight's topic. Similarly, one of our goals at the national committee level is to start having these national level medical student events quarterly. So if you find tonight's webinar helpful, we hope that you'll follow us on social media and get involved with your local chapters about future events. So with that said, I'm going to go ahead and introduce our amazing panelists tonight. Joining us, we have Dr. Karen Brazel. She is the program director for the General Surgery Residency Program at Oregon Health and Science University, where she's also a professor of surgery and is the vice chair for education and the assistant dean for graduate medical education. We also have Dr. Lily Chang, who is the program director for the General Surgery Residency Program at Virginia Mason Medical Center. And our list is Dr. Stacy Gray. She is the program director for the Harvard Medical School in Massachusetts Eye and Ear Otolaryngology Head and Neck Surgery Residency Program, where she's also an associate professor and the vice chair of otolaryngology education at Harvard Medical School and is the director of the Sinus Center at Massachusetts Eye and Ear. So for our panelists, to have everyone kind of get to know you a little better and put faces to the names, would you mind briefly introducing yourselves with a little more information about your clinical practice and maybe one thing you enjoy doing outside of the hospital?
Sure, I'll go first. I call it my night job. I'm an acute care surgeon. I do 1 week of service related to either trauma, ICU, or emergency general surgery every month. And then I also take my share of weekend and night call. And outside of the hospital, I really enjoy running.
Sorry, go ahead.
Oh, no, please go ahead, Dr. Chang.
I'm Lily Chang, and as you said, I'm the program director here at Virginia Mason Medical Center, and I've been here for about 12 or 13 years. My side job is bariatric surgery and general surgery, and outside of the hospital, I enjoy spending time with my family.
Wonderful. Thank you both so much for introducing yourselves. Dr. Gray, are you on quite yet? Okay, well, we'll go ahead and get started, and I'm sure Dr. Gray will be on shortly. So we're going to start off with the CV portion tonight. So our first question is just generally, what is the general purpose of a CV for residency applications?
I guess I can go ahead and get started. I think the general purpose for a CV is to really list all of your achievements and accomplishments. Most program directors are looking for kind of your experience, even jobs that you've had, even ones that aren't related to medicine. We're trying to get a idea of your character, things that have shaped you in the past, and a lot of that we can glean from your CV. It's kind of a nice snapshot of figuring out what you've managed to accomplish in your life over the intervening years since I guess you were a child. We certainly don't need everything that you've done, but all the important things.
And I really look at the CV that you craft as your way to tell your story, and not only what you've done in terms of accomplishments, but what those accomplishments represent. Not in a narrative form, but if you got an award that I wouldn't necessarily know what, because it's named for somebody, and I don't know that particular person or what that award means, it does allow you to communicate what that was for and why that was important.
Okay, perfect. So kind of going into like the nuts and bolts about it, is there kind of like a format you recommend students follow? And is there a length people should aim for? Like, for example, should it be no longer than X number of pages?
I really think it can be as long as it needs to be. I think we're good at figuring out when there's a lot of fluff in there, if you know what I mean. And so we will recognize that. But I think that if you have a lot of accomplishments, I don't think that you need to try and pare it down to a certain number of pages. And so whatever I think you think tells a story about who you are and the kind of person that you are and your experiences that you've had, I think you need to include that in there, even if it's multiple pages long. And I don't think that that's a problem. I see in the chat, one of the questions is how far back is reasonable to go back in terms of work experience, e.g. non-medical. I don't think that there is truly a limit. I started working in retail when I was 14, so I don't think that that's really important. But at the same time, I think it's important to know that at some point I actually had a job. And even if it was non-medical, it means that I had to show up for work, I had to come on time, I had to clock in, clock out. It shows a certain level of responsibility. There are, believe it or not, there are people who come into residency and they've actually never had a job. And so, and that's actually something that I look for, that, have you had a boss before in your life, besides your parents? So I think that's important.
And I think it's important to make sure there aren't any gaps in terms of, so what did you do for these 4 years that between the time that you graduated college and the time you started medical school, because leaving a gap leaves it open to interpretation, and that interpretation may not always be in your favor. So you really need to explain, and it may be that you didn't have a job, it may be that you were a volunteer, it may be that you did something else, but finding a way to ensure that there are no gaps, I think is important.
Okay, that's very helpful. In terms of kind of like the categories to include, what are kind of the big like categories you look for? And is there a way that you think those should be organized? Like, for example, should you start with your research, with your extracurricular activities, with your academic honors? How do you suggest kind of organizing those things?
I think my guess is that we will all have answer this slightly differently, which goes to that we were probably all trained differently. I write mine education, my awards, my research, my publications, and then I would put other jobs and then extracurricular activities. That's how I do it, but I don't know of anything out there that says that's better than putting your other jobs up in up closer to your education, say.
Yeah, I agree with Karen. I don't think there's a right way or a wrong way. I don't think I've ever looked at a CV and said, wow, that's organized totally backwards. And, so it definitely, I don't think is that big of a deal how you organize it. But traditionally, Karen's right. I usually expect to see someone's education first. So where you're medical school, where you went to college, if you've earned, master's degree in something else. So I think that education is important. I don't know that I've ever seen anyone list kind of their high school education per se. I think it usually just starts at college, and anything you've done from college. And then awards and honors, research, jobs, extracurriculars, things like that. That's, I think, generally the most traditional way.
Okay, perfect. And I guess kind of like my sub question with it is like, do you read it? Like, do you assume that the order people are putting them in is like the most important thing to them personally? So like, for example, if you come across research first, are you assuming like, oh, this is somebody who research is really important to them and they're probably more like academically interested, versus if they have like extracurriculars first, would you be like, oh, maybe this person isn't as interested in research? I don't know if I'm articulating this well, but
yeah, I understand what you're saying. No, I wouldn't think about it that way. I would expect at some point all the elements are going to be there, and the order in which you put them does not speak to me as this is more important to them, and that's why I'm putting it first. I read the whole CV from beginning to end, and so if it was closer to the bottom, it doesn't mean it's not as important.
And I see Katie's question. I would say yes, include research experiences, even if you did not get a presentation or a publication out of it. That may set you up for a question from somebody that says, essentially, either why did you not, why did this not result in a presentation or publication, or what did you get out of this, this experience, seeing that you didn't get a presentation or publication? And plenty of research does not lead to presentation or publications. Just know that you might be opening that question for somebody to ask.
And we had kind of a similar follow-up with that, which is how should you include like non-peer-reviewed publications, for example, things like blogs, podcasts? Should you have like separate categories for peer-reviewed and non-peer-reviewed, or how would you suggest showing those?
I would have separate categories for peer-reviewed and non-peer-reviewed. I think if you have, well, let me think about that. I think if you had a lot in each category, then it probably would be good to separate them. But I think if you had one or two, maybe three, or just a small handful of research projects, I think it will be obvious what's peer-reviewed and what's not peer-reviewed. So you could actually put it all under one category. I might not label it research because I don't think that a podcast or something like that technically would come under that heading of research. So you'd have to think about a different heading if you're going to put it all together. What do you think, Karen?
Yeah, one of the advantages, I think, to separating it is then, for instance, on my CV, it's separated. And so if you start if you start early with the categories you'll use later, you don't have to keep changing. On the other hand, if you do just have one in each, it's sort of, it's not necessary. I'm trying to think of the word that I've seen used for podcasts and some of the non peer reviewed. You can put non-peer-reviewed materials or educational
activities.
Yeah.
Okay, that's helpful. And I think on a similar kind of topic, do you recommend writing like short descriptions about your research activities or like any of your leadership in general, or do you just like to see them listed out without like the narrative included?
I like to see a one sentence if it's not self-explanatory. I do not want a narrative, but a one sentence really to tell me what it is, because otherwise it helps me understand the relative value of it if I see a little bit of a narrative.
Agree completely.
Okay, wonderful. And then I know one thing that can come up often is that there can be kind of like overlap between certain activities. Like, for example, different leadership positions kind of inherently have like an aspect of volunteering involved with them as part of your job. Do you view it negatively if you see those sorts of things like double listed under like volunteering and as a leadership activity? Like, do you view that as someone trying to like fluff up their CV or make it look longer?
I would just include things once.
I would too. Yeah, I would do that as a way to try and make it longer. It may not be, but that's my bias.
Okay, perfect. And I think we already kind of talked about how far back people should go and if they should include experiences from high school and college. Were there any other thoughts you wanted to add to that?
I think if they're really important experiences that really shape who you are or are significant, you should include them high school and college. I think that more routine extracurricular activities that you would do, particularly in high school, are probably less important. But there are some things that people have done in high school that are extremely impressive. And I think it's valuable to show those things when they really speak volumes about who you are.
And I would say particularly if they are things that we all have a kind of a common understanding of, national awards that you got in high school, strong leadership positions in high school, whether they were actually related. I mean, it could be valedictorian, but it could be some national leadership position with your church. And if that's, to me, that speaks to leadership, which is one of the things that I try to glean from a CV. Okay.
And in terms of like academic honors, how do you both feel about including things that you might have been nominated for if you didn't end up getting it? Like, for example, if you were like nominated for an honor society, but didn't end up being inducted into it, is that still worth mentioning or not so much?
I guess I'm kind of plus minus on it. I think I guess it depends on what the nomination was for. If you were one of the finalists for the Nobel Peace Prize, I would totally want to know that. So I guess it depends on how impressive the award was.
And then just kind of overall, what would you say are some features of a strong CV, of a CV that kind of sticks with you or catches your eye? And what are some common mistakes that students should try and avoid?
I think a strong CV is one that is very easy to read. And it, not necessarily from brevity, but the section headings are very clear, the story is clear, the font difference is clear, and it shows that the person doing it really kind of understands what they want to convey and want to communicate. And there was a question in the chat about a narrative. I don't think a narrative in terms of kind of what you're looking for, that to me is what the personal statement is for, not the CV.
Okay. Did you have any additions, Dr. Chang?
I think one of the pitfalls is when it seems relatively obvious that you're trying to, kind of fluff up your CV more than it should be. I think that it's not a common pitfall, but it's something I see every now and then, and I think that should be avoided.
What are some like red flags, I guess, that shows that someone is trying to pad their CV?
I guess things that are either double mentioned, as we kind of said earlier, things that seem like they're not, I guess, particularly relevant. Sometimes I've seen this more with resident CVs than with medical student CVs, but presentations that were really just small group presentations, but made to look like I presented at grand rounds. I'll see some people, where, they are outlining a presentation that they may have given to their classmates of 5 to 6 people and trying to kind of display that as if it was a bigger deal than it was.
Okay, that's helpful to know. Did you have anything to add, Dr. Brazel, or did that kind of cover it as well?
I think that's the big one. The other thing is including too much narrative. The CV is really, it's intended to tell a story, but it's not intended to be a narrative.
Okay, wonderful. And then my last kind of question is, because, and here we have Dr. Gray coming. How do you feel about the like extracurricular interests at the bottom? Like, is there a way to kind of make those stand out a little bit more and not have them be kind of like the typical, like being outside, cooking, hiking? Is that something you really look at?
I look at them just because I try to make it a point to know one thing about people I'm interacting with that is completely non-medical, just as a touchstone for conversation. So if somebody said they like to do jigsaw puzzles, I would find that quirky. And but if it was jigsaw puzzles and being outside and cooking and reading, and at some point it's sort of like, okay, that makes it less, that makes it stand out less. It makes it less interesting because it's just a long litany of things that a lot of people like to do.
Okay. Dr. Gray, I see you got on here. We're so happy to have you. We're just kind of wrapping up our CV section. We're going to move on to personal statements soon, but would you mind kind of briefly, we did kind of your academic intro, but would you mind just introducing yourself and your clinical practice and something?
Sure, and I'm so sorry that I'm so late. I couldn't get in for some reason. I don't know what was happening, so thank you for having me even though I'm late. So just very briefly, I'm an otolaryngologist and head and neck surgeon, and my area of expertise is endoscopic sinus and skull-base surgery. And I practice at Massachusetts General Hospital and Massachusetts Eye and Ear in Boston, and I'm the residency program director there.
Wonderful. Well, we're sorry you had some technical problems, but are so happy you were able to join. And even though we're wrapping up our CV part, we still have a lot of questions in the chat that Amber will come back to at the end. So we'll definitely still be able to hear some of your CV advice at the end when we answer the rest of our questions.
No problem.
But with that, I'm going to go ahead and hand it off to Kayla Hicks, who's going to take over moderating for the personal statement section. And again, for anyone whose questions are in the chat, we're going to come back at the end and address all the questions that are left over.
Great. Thank you, Annalise. As she said, I'm Kayla Hicks. I'm a third, 3.5, somewhere between 3 and 4 year medical student at Case Western Reserve University, School of Medicine in Cleveland. I'm going into ENT, so super excited to have you here, Dr. Gray. Before we move on to the CV portion of our panel here, I was wondering, Dr. Gray, do you have anything in particular that you want to say about personal statements? Because we do have some time. do you have anything that you want to say about CVs? Because we have some time before we talk about personal statements.
So I think one of the nice things about ERAS, and I'm not sure if this has already been mentioned, is just because the sections that are listed there really do often make creating the CV actually fairly simple. And so that following that format, I think, is probably the most important thing. And there are sections there to really just, I think, explain further experience. And that's what many of us are looking for. Is really, if there's something that's not very obvious from the title, is really just a secondary explanation to really show us what that experience actually was all about.
Fantastic, thank you. Do you have any tips? What are some things that you look for in a CV, and what are some red flags in a CV? In a CV.
So for a CV, I would say, the things that we're looking for really are, very brief. It's an introduction, essentially, of where your training has been. So we're either college and medical school. And then really sort of experiences, including research and outside of sort of academic experiences, whether that's volunteer work, or things that people are passionate about. And I think that that really is sort of what I'm looking for, really is why people have been drawn to the field of medicine, what brought them to the field of otolaryngology, and things that they have decided to spend their time doing. And if that includes mentorship, if it includes working with students, I think all of those things are things that are easily seen in a CV. And it really just, again, it's your life's work. It's sort of what you have done up until that point. I'm not sure that they're necessary. I think the only red flags are inflating things. So making statements where, if it was a volunteer experience that was for an hour or two and that gets listed prominently, and then when you're asked about it, you can't really back that up. I think that's a concern. And then the other thing is that usually there's a section for hobbies and sort of activities outside of what you do. And similarly there, if you write something like ballet or, cooking, Thai food or something like that, you need to really sort of, because those are often things that people will ask you about when you're then in an interview situation. And so to list it there really means that you're, extremely either knowledgeable or passionate or really excited about something and are going to be able to have a conversation about it. And so I wouldn't list something there if it was just sort of a cursory understanding. And that goes also for sort of fluency in languages as well, just because that is something that is often something to talk about when you're meeting with somebody, especially if it's a shared experience. And so you want to make sure it's something that you really are very knowledgeable about.
Thank you. And then finally, you are our only surgical subspecialty program director involved today. So are there any things that you would say are different about your CV in regards to applying to a subspecialty like ENT versus perhaps general surgery?
So I think one of the things that often people are concerned about is that and this is not just for otolaryngology, so I'm going to try to speak for all surgical subspecialties. Many people who decide that is what they want to pursue, they don't make that decision until quite late. So sometimes they don't actually have that direct experience during their third year clerkships, or it's early in their fourth year clerkships. And as oftentimes what happens is people will have a wonderful experience on surgery and sort of realize that that's sort of what they're really excited about. And then they might not have a chance to explore all of the surgical subspecialties. And so I think some students express concern that perhaps they don't have the depth of research experience, or they might not have as many clinical experiences in that surgical subspecialty. And most of us realize that that's okay, because most of us were drawn to the field later just because it's not a typical experience that everybody has as a third year student. And that's okay. So, and a lot of times we will see letters of recommendation that are from, for instance, general surgeons or other surgical subspecialists, and that also is fine. And especially this year, just with the limitations on away rotations due to COVID-19, we're certainly all really very understanding of that. And that's why most of the surgical subspecialty sort of organizations for program directors have really reiterated that we understand that the application, especially this year, is going to look very different. So that experience we're even more understanding of this year, and again know that experiences within general surgery or also within internal medicine are very important too. So those grades and those surgical clerkships, for instance, are very important.
Great, thank you. So with that, we're going to move on to the next section of this panel. So we know as medical students that personal statements are one of the most important and also one of the most stressful portions of filling out your fourth-year residency applications. And we know that in particular this year will be very important because it's one of the only things that you can see to get to know us, because we won't get to meet you in person during the interview day. So with that, our first question is, what is the general purpose of a personal statement for you guys? So what are you looking for out of a personal statement?
I can start, I guess. What I'm looking for, it's really, I think the personal statement is an opportunity for you to share with us maybe something unique, a special experience about you, what is impactful in your life, or a special circumstance, or why you're drawn to the field. I think those are all common themes that I've seen. And it's really an opportunity for you to share that with us, something that you might not necessarily glean from your CV.
I also think the personal statement can be used to address something, how you have turned something that was an adverse event, an adverse experience that you've had, something that your CV may portray in a negative way. I think the personal statement is a way to further explain that and put it in a positive light, whatever that might be. I have seen personal statements do that actually quite well.
I agree with that, both of those statements. I think one of the things that we're generally looking for, again, is sort of a rationale for what brought you to this point in wanting to apply to the specialty that you've chosen. And also, I think really what we're looking for are people that are, again, dedicated and passionate to whatever they have picked, and whatever has drawn you there and has led you to that point. Being able to sort of say that in the personal statement is, I think, is really sort of what we're looking for. Again, a story for the path that has brought you to that point.
Cool. So how do you weigh the personal statement when deciding who to interview?
There's so many things that we think about when we're deciding who to interview. And I think this upcoming year we'll be thinking about even more and perhaps different things. And the personal statement, as you mentioned earlier, may actually carry a little bit more weight, since the applications may tend to look a little bit more uniform. And so it's a potential opportunity to kind of set you apart from the rest of the pack, if you will, and share something unique. I also, I'm sure you'll get to this later, but one of the pitfalls is also when you make it really unique, that can backfire a little bit. So you have to be really careful with that. I think there are some people who are really good at writing and creative writing, and they can pull it off really well. And then there are other people who try and pull off something super creative, and it doesn't necessarily, I was never a good creative writer. So I really stuck with the kind of the template of the 5 paragraphs, the introduction and and I really didn't really get super creative in mine. but I think some people have a real art and a talent and a skill for that. So if you do, I would certainly showcase that. And then, as we all mentioned earlier, it really is this chance to show us who you are and your passion.
I do think they probably will be a little bit different this year. In the past, there have been a small minority where a very poorly done personal statement has tipped the balance in one way, and a very, very well written, passionate personal statement that really speaks has tipped it the other way, and the vast majority have been relatively in the middle. I happen to be blessed with an almost innate, although there was probably an elementary school teacher involved, ability to spell well and have good grammar. And so that's a big sticking point for me. And I get that that's not necessarily everybody, but that's a real, I think we have to be able to communicate well. And I think the personal statement is your chance to show me that you can communicate well, not just in the story that you weave, but in actually the mechanics of that communication.
Yeah, I definitely agree with that point. And one of the things that I was going to say is both from the standpoint of grammatical construction and also content, I think one of the easiest ways to help with that is to actually ask for advice from your mentors. And I certainly think that if you're in a situation where you have even residents in the field that you have chosen, that you have worked with, like on a team when you were in a hospital, they often are very willing to read personal statements for applicants, especially if you've gotten close with them when you're working on a team with them, and especially if they've shown an interest in you and want to really make sure that you do a great job with your application. And asking them to sort of look at that first often is a little more comfortable than maybe asking whoever your advisor is within the field. But depending on that relationship, I think actually having someone who has some insight into what people are actually looking for and can review your application in that way is extremely helpful. And that also might point you in the direction of saying, okay, even though this is something very personal that I'm sharing, maybe it's too personal, or they might be able to encourage you and say, yes, that's actually something that you really want to highlight, because that's a very, it's a very powerful statement, whatever it is that you're saying, and especially if you have a natural talent for writing. The other thing, and I'll just mention this because this is specific to otolaryngology, there has always been the possibility of personalizing the personal statement depending on where you're applying. And several years ago, I think it was probably about 5 or 6 years ago now, otolaryngology on a national level actually asked applicants to include specific program-specific paragraphs sort of at the end of the application. And we ended up abandoning that because what we found was that students still continued to sort of apply to 70 plus programs. It was just really burdensome, and it wasn't actually very helpful for either the programs or the applicants. And so we stopped doing that several years ago. However, this year, I think, is potentially the year to use this as an opportunity when we're not many schools are not allowing away rotations. And I'm looking at it, not that you should include that in 70 applications for sure, but if there are certain programs that you would have normally shown your interest by doing an away rotation there, then it might be very applicable to include something specific about your interest in that program, especially for geographical reasons, or if there's something within your sort of portfolio, or a research opportunity or something that you've done in the past that you're really, there's faculty there's something about the program that you're really interested in. I think one of the things for all program directors this year is we are highly aware of the fact that this is always a time of significant anxiety, and because of COVID-19, we know that this is even adding much more anxiety to the whole process this year. So I don't want that to be seen as something to add extra, again, stress to the whole process. But for people that really have, if there are like 5 programs, that there's something really important about it that you want to convey, I think it's an opportunity to do that. The only caveat is you have to be very careful when you're doing that you don't mix up the programs. So the worst thing you could do is accidentally submit an application that you're touting the things that you really like, but it's the wrong program. So you have to be very careful if you choose to do that. But I do think it's potentially a way to mitigate the fact that you're not able to do an away rotation this year. So it's something to consider.
Great, thank you. So we've sort of talked about this a little bit and touched on it, but in general, what type of content do you think should be included in a personal statement? For example, why, X specialty, special circumstances about that person, experiences, attributes. Should you highlight accomplishments from your CV?
I would say don't retell your CV. You have a limited amount of space to get your story across, and you don't want to waste it. You want to give new information. I think for me, the more personal, whether that's a patient story, whether that's a life story, the more personal, the more attention grabbing it is to me. I've sent a few personal statements. I don't actually edit personal statements a lot because I do think they are very personal, and I can't tell you what your story is. I can help you try to convey that story, but I can't tell you what your story is. So I've sent 2 back and said start over in my entire. I've been doing this 20 some years. One was an advisee who I knew quite well, and he did not, although his scores were fantastic, he had very, very little involvement in his medical school. And so his CV was quite thin. That was because his fiance had a 10-year-old boy, and he was the boy's essentially father figure. And so he spent a lot of time going to parent-teacher conferences. He coached some sport for the kid, and none of that came through. He wrote a generic, I like to work on cars, and therefore I like to work with my hands, and so surgery is a good fit for me. And it was very generic. And I said, I happen to know you, and this does not tell your story. And he said, funny thing, his fiance's name was Lisa. Lisa said the same thing, which I think highlights another suggestion that I give all of the students that come to me. Have the people that are important in your life, not just residents and advisors, but have the people who are personally important to you read your CV and see whether it tells your story. The other one I sent back was like a 3-sentence personal statement that essentially said, my true calling is to be a Jedi Knight, and surgery, I think, is an appropriate second choice or something. And I was like, and again, this was some years ago, that's just too weird, and surgeons we're not there yet. That's just not going to be okay.
I would have sent that one to Karen. Sent that one back to Karen.
Little too out there. Maybe we've come to the point now that I could just actually ask them to lengthen it, and which I think a good personal statement is somewhere around 3/4 of a page. It don't go longer than a page.
Definitely don't go longer than a page.
And don't go as short as a paragraph.
I'd agree. 3/4 of a page is ideal. Definitely, if it's anything longer than a page, I think it's too verbose. It doesn't have to be. We've talked a lot about this, either creative or telling a story. And sometimes I'll have people come to me and they honestly say, I don't really have a story. And that's okay. You don't have to have a story. And don't make up a story, please, whatever you do. Do not make up a story. So only tell a story if you really have a story and if that story is, says something about you. I think most people have some sort of story or experience that does say something about them, whether it's your upbringing, your parents, your siblings. In this case, what Karen was mentioning, it was his, relationship with Lisa. And so those are all really meaningful. And so I think we all have them. It's just whether or not, you want to share them, because sometimes you don't. And then if you truly don't have one, or one that you think is worth sharing, then I would actually just write I love to work on cars. Write a generic one, because that's not going to hurt you at all. Like, no one's going to say, another vanilla, plain story, and that person doesn't get an interview. It won't work against you in that way. It's safe. It's okay to have a safe CV.
And I would totally agree with that, because I think probably 75% of the applications that we see, that is what is there, and that's okay. And again, especially if it is well written grammatically, the spelling is correct, and there's somewhat of a point to it. It usually involves, for otolaryngology specifically, I really liked the head and neck anatomy section. That's when I really started liking this, and then even just discussing, spending time in the operating room, a case that you really enjoyed. All of those things can be very relevant, and it doesn't have to be like an amazing story. I mean, sometimes we see someone who had a cochlear implant when they were younger or something, and obviously that is really going to, or they had a sibling that had a significant issue. Those things can be used. On the other hand, the majority of people don't have that. So I don't think it's anything, if you do just write a well-written personal statement, that also will be fine. And I think the other thing to remember is that it is only one portion of the whole application. And so, it alone it's rare for that to be the sole reason, other than what has already been mentioned. If something is like way out in left field, it might draw people to say, maybe something is a little strange here. And then on the other hand, sometimes you see a personal statement that's so incredibly well written and so poignant that they really stand out. But for the most part, it's just sort of standardly in the middle, and that is all okay.
Perfect. Thank you. That was so helpful, everyone. So you actually answered our next question, which is, what length should your personal statement be? So we'll move on to the next one. Just like we were talking about with CVs, we're wondering, for you guys, what are the features of a strong personal statement, and what are some common mistakes and cliches that people should avoid when writing that?
Definitely proofread your CV. Have someone, the grammar thing is big. I think as physicians, doctors, surgeons, we can tend to over nitpick things like that. So no spelling errors or grammatical errors. And I think that it shouldn't be too complex either. Try and keep it focused, simple. I don't know that there are cliches that you have to avoid. I think, as we've said, 75%, if not more, of the CVs they're great CVs. They're really well written, wonderful CVs. They don't necessarily stand out amongst the pack, but they're well written, and that might sound like a cliche, but that's okay. So I think, I think those are the things that I would say about mistakes to make. I don't know that you can make huge mistakes if you kind of follow the guidelines that we've said.
I would, and there's a question in the chat about deeply personal, relevant stories, and you will probably hear differing opinions about that. I am perfectly happy hearing and reading those in a personal statement, and my question back would be, if that is that important to you, you probably need to figure out if that's a place that is going to honor that part of you. And so by not sharing it, you may not get the opportunity to figure that out as well. But it is perfectly fine to write a safe one. I think it's perfectly fine to share a deeply personal story.
I completely agree with that too, but I think that's probably not true across the board. But my advice always to people that I'm mentoring is that exactly what you just said, which is if there is an issue that is very important to you and you would not be comfortable going to a program that is uncomfortable with that, it's actually better to not necessarily even have an interview at that program. It just might mean that before you get to the interview component, you are selecting yourself. I actually think that is okay. If it's something that you're really passionate about. And the other thing is that oftentimes those things come through because of the rest of the application, because of your volunteer servicing, and because of organizations that you belong to. And again, even the places that you apply to, you probably have some sense of that anyway, that there might be shared belief systems, for instance. And I think those are things that are really important to think about. And yes, if it is important enough for you to mention in the personal statement, I do think that is okay. But I think that different programs will view that differently.
Wonderful. Thank you, guys. It's so great to get your perspective on these things that all of us are wondering. So it's 7:53. Dr. Brazel has to leave us soon. So I just want to open the floor up to her. If you have any closing thoughts that you want to do before you leave. We are so sad to see you go.
Well, thank you, and I do apologize that I have to leave, although I am excited to celebrate the largest class to ever graduate from a surgical program in the country ever. So we will be celebrating them tonight. I have 15 chief residents that we are graduating tonight, or celebrating tonight. They still have to work a few more weeks. I just want everybody to know that we are figuring this out this year too. And so it's a stressful time anyway in a non-COVID year. And as much as I can to try to take some of the stress, the COVID virtual related stress away. We are working to figure this out, and all of the program directors that I have been talking to want to be helpful. They know it's stressful. They want to showcase their program in a really good light, and they want to help you figure out how to showcase yourself, but also how to do the match and get the fit correctly. So try not to stress about it.
Thank you so much for joining us. Have a great time tonight. We're so happy to hear that you graduated 15 people, and please tell them congratulations.
Most of them women, actually, as it turns out. Most of them women.
Please tell them congratulations from us. Everyone in the chat wants you to know that we thank you for your help, and it is so impactful for us to get to interact with you and to hear your perspective. So thank you so much.
Thank you all, and I'm sure I will be talking to many of you over the next several months.
So with that, if everyone else is ready to keep going, We have another question. So we talked a little bit about putting sort of love letters at the end of your personal statement to particular programs. We're wondering, is it a disadvantage to particularly discuss a geographic background? So like if you're particularly tethered to the Midwest or specific career goals. So if you want to do peds ENT or peds surgery, in your personal statement particularly, if you do this, will it put you in a box? Should you address this up front?
So I do think that, one of the things that comes up often is if you, and especially on your CV, for instance, if you have been in the same location for a very long period of time, then I think some applicants have the concern that, if you've been predominantly in the South for most of your upbringing and training, that if you're applying to a school in the Northeast, that maybe that program won't think you're really serious about leaving the South. I don't think that's really true on program standpoint, because they're really just looking for the best applicant. And I can say, for my own program, when we're reviewing applications, we're looking for the applicants that are coming with the best sort of qualifications and that are going to be really happy to be in our program. So if there is a reason why you are interested, in the past, I think that was seen by doing an away rotation. I think that was sort of a very simple way to show interest in a different program. And this year, obviously, we can't do that. It is an opportunity to state that. And especially if you have family in that area, those are all very reasonable things to, if you're comfortable putting that into the personal statement, but it's really not necessary. I think the other thing that usually happens, and this is sort of outside of the personal statement, is, again, I do think that mentorship is very important, especially sort of within your specialty. And I think what often happens is, if you decide if there's a program you're really interested in interviewing for, that's something that your mentor can reach out to that program as well, especially if it's something that you're worried that your application might not get as much attention because of the things that you're sort of mentioning. As far as subspecialty interest, I think it's fine to write about that if that's something, again, that is really drawing you to a field. And I don't think, at least for otolaryngology and for some of the surgical subspecialties, I don't think that's viewed as a negative. You have to go through all of your whole training first before you decide to do a fellowship, but I don't think that that's either a negative or a positive. And again, if it really sort of speaks to the reason why you're picking the field, that's really sort of what's important.
I would agree with Dr. Gray. I think that if you've got certain career goals, it's actually really nice to know that someone actually has some goals. And we also recognize that might change. I can remember through medical school, I was going to be a primary care provider, and then I was going to be a neurologist, and then I was going to be a cardiologist, and here I am as a bariatric surgeon. So it's okay to start with something that you think, says something about who you are and why you're drawn to something, and then it's actually still also okay to change. And so even the residents that come, it's funny, for the graduating residents, I'll go back and I'll read their personal statement from when they were interns, and it's so funny to hear what they said and how perhaps different or not different you came and you did exactly what you said you would do, or you came and you didn't do anything that you said you would do. But here you are, successful and ready to kind of embrace the world of surgery. So it's okay to put yourself out there. Again, be truthful, be honest. Geography is tricky a little bit. I think that a program wants to hear that you want to go to their program because you want to go to their program, because it's a great program and you're going to get great training and you think the fit will be great, or whatever the reason is. But I don't think a program wants to hear, I want to go to Mass Eye and Ear because it's in Boston. You want to tell Dr. Gray that you want to go to Mass Eye and Ear because it is the best damn program in the country, and I couldn't possibly imagine going anywhere else, not because I want to go there because it's in Boston. And so while location is important to you, and I'm not going to deny that location is not important, that's actually in some ways not what program directors want to hear. So I would be careful about answering why do you want to come here, and having the first word out of your mouth being because I want to be in a certain location.
Wonderful.
I totally agree with that. I should say, sorry. And it's funny that you're saying that about reading the personal statements, just because one of the things that we do for graduation for our chief residents is, as part of their roast, is actually to go back to their personal statement and quote them. And some of them are absolutely, it can be very funny, actually. As far as the sort of the geography, I totally agree with that. That is, the city itself or the region that shouldn't be the main draw. And again, I think one of the things that sometimes people are worried about is, again, if it doesn't look like you would ever come to a different area of the country. And I don't think you need to necessarily address that in your personal statement. And again, I don't think programs necessarily feel that way, again, because they really want people to come because it's going to be the best fit for their program. But if it's something, again, if it's a program that you're really interested in and you really want to make that point, I think that is a time that maybe using this sort of personalization is a good idea, to say, I'm really excited to spend time in another part of the country for my residency training, and sort of reiterate that. But again, I think that you really don't need to do that. It's just something that if you really want to reiterate something or pick specific programs, that it might be reasonable. But I actually think reaching out to your mentor in that situation is actually a better way to convey that.
So off of that in particular, Dr. Gray, you've talked a bit about writing tailored portions of your essay to your top programs, but Dr. Chang, we were wondering from your perspective how you guys view at that portion of a personal statement.
Yeah, I think I'm always impressed when someone does tailor their personal statement to our program, because I know that it takes extra time and energy. And it makes me feel that they have really thought about our program and didn't just check a box on IRIS to apply to the program. That they know something about our program that draws them to our program. So it makes me think that they're actually interested. But it takes a lot of bandwidth to be able to do that, which most people don't have that bandwidth. So it's certainly not an expectation. And it certainly is not something that I mean, if I see it, I'll be pretty impressed with it. So you could do it for your top few programs. And I think that would be a pretty powerful statement to those programs that you're really interested in them. But most people are applying, from what I've heard, to 50-ish programs, which is really scary to me. But and I'm sure it will go up this year, is my guess. And the other scary part is that you'll actually be able to go to all 50 programs because you don't have to fly there. And so there is this, I think a lot of programs really want to know, am I just a box that you checked, or are you really interested in my program? And that's one way of showing it. So I would consider it for your top programs if you have the bandwidth to do it.
Great, thank you. And then our final question, you guys have touched on it a little bit, but who should you ask to edit your personal statement?
So I think the first person should be someone that is like your best friend or your spouse, and someone who, like my husband, who went to an all-boys school, his grammar is impeccable. He is not a physician, so has no idea what he's actually reading, but he is excellent at cutting out any unnecessary words. So I think having somebody who can do a very in-depth look at the very beginning that you're not burdening. I think that's what I would start with. And I loved
someone mentioned this earlier, the idea of making sure that it really does represent you. And the person who is very close to you, whether that's a sibling, whether it's a parent, someone who's been reading your personal statements, potentially for the last 5 years. And then after that, I do think that if there's somebody that you're close with that is in residency, or someone else that you feel comfortable that has gone through the process, so that they at least have a little bit of a sense of what personal statement looks like, that would be maybe the next person. And then certainly it depends on your medical school and how your advising system works. But for instance, in our system, our advisors typically do want to review your personal statement. But at that point, it shouldn't be a matter of adding grammatical content. It should really just be making sure, like a final stamp of approval, like, yes, this is ready to go.
I agree completely.
Wonderful. Thank you so much for talking so thoroughly about personal statements with us. This was absolutely fantastic. So we're going to move on to the next portion, so this question is specific for international medical graduates, underrepresented in medicine, and DO students. So do you have any specific or unique advice for these groups of people?
I think these groups of people actually tend to have more unique experiences, and I think those really should be highlighted. And I think just by virtue of the fact that they're either, IMGs, underrepresented, or DO students, that tends to make them unique, and I wouldn't necessarily shy away from that. And I would, and you can't shy away from that. It's all right there, right? Maybe not the underrepresented minority portion of it, but at least the IMG and the DO students. That's, it's there on the CV. So in some ways, I would embrace it and maybe not try and kind of downplay or underplay it.
I totally agree with that. And I think that the personal statement is actually a great way to tell that story. And so using it in that way. And then also, I think when you're soliciting letters of recommendation, the people that are writing the letters for you, I think that's also something that they often will highlight as well. And oftentimes it's easier to have somebody else do that for you a little bit. So if you have strong letters of recommendation, I think that that really kind of rises to the top as well. And I agree, it's not something that you want to try to bury somehow. It's something that is very clear based on reading the application, and it should be embraced. So I think finding ways to highlight it is the best way.
Fantastic. So thank you both for sort of guiding us through the muddied waters of writing a personal statement, especially in the COVID era. So our next portion of this is going to be questions that have been in the chat or have sent directly to our wonderful other moderator, Amber. So Amber, right here.
All right. Hey, everybody. My name is Amber Priester, and I'm an MS3 at East Carolina University in North Carolina. I'm also a member of the AWS National Medical Student Committee. Throughout this call, I've been compiling questions from both our Zoom chat and our YouTube live stream. So please continue to leave your questions in either chat or private message me, and I'm going to do my best to incorporate your answer. All right. So our first question for our panelists, pretty basic. For formatting your CV, should it be colorful? Should it be rigid, black and white? And also, should you put things in chronological or reverse chronological order? Does it even matter?
They should be in chronological order. I don't think that it necessarily needs to be reverse or regular, but they just can't be all over the place. So have an order and stick with it throughout the entire CV. So if you're going to go in reverse chronological order for your education, then make sure that everything else flows in that same way. So don't switch partway through, but pick one and go with it. I usually find it's easier to start with the earlier thing first, especially like for research, because in the end, when you're compiling your CV, which you will do throughout your whole career, it's easier to add your newest thing to the bottom of the list. And so I do think that tends to make the most amount of sense, and that's kind of how we think. And then, gosh, what else did you ask besides the chronological order thing?
About should color be included, or should it be black and white?
In ARIS, by color you mean like visually color, or?
Yes, I think the question was about people who are giving a paper copy of their CV.
Oh, I see. Yeah. Well, I don't think that I've received a paper copy of a CV in a very, very long time. So it's going to come out as black and white, I think, even because it's all through ARIS and you just type it in. I guess maybe you haven't started doing that yet, but when you do, it's not like you upload a PDF copy of something. But I would say in surgery, I would stay away from color. I wouldn't make it cute. I wouldn't make it flashy. I would just make it pretty standard. Even though it's a way to stand out, I think in the end it will work against you.
I agree with that. I would say, so one thing, and it is true, so when you do the actual ARIS application, everything actually looks the same. So no matter what your CV looks like at home in Microsoft Word, for us to review, it just all looks exactly the same. The font is the same, the formatting is the same, everything is the same, and it's obviously in black and white. I think that most medical schools have a format that they follow, and certainly I see a lot of our students that use that sort of standard medical school CV and that it's a great thing to sort of have really well formatted, because you're going to have it for your whole life. And I agree with just the way that we format it at our school is basically starting with the oldest stuff is at the top, and then you just list it in chronological order. I think the most important thing is looking organized, making it very neat, and you want it to be very easy to read. So I also would agree with not adding anything extra. It's not you really want to just convey information and make it very easy for the reader to actually find what they're looking for. So having different sections that are very clearly labeled is really important. But I would say plain and black and white.
Great, thank you so much. So moving on to our next question. Somebody asked, if we had research that was accepted to a conference that had to be canceled due to COVID, should we still include it on our CV, and how should we denote that it was canceled?
I absolutely 100% would include it, and I would just obviously say what that presentation was going to be, the title of it, and then somehow say that the presentation was not actually delivered due to COVID-19 or something like that. But the intent was there, that it was supposed to be presented, delivered, what have you, and that is still important. And I think you absolutely should mention that. And as we were saying earlier about research that you've done that's not published, just because it's not published doesn't mean you didn't do the research. And there's a lot of research that happens that goes unpublished for one reason or another. Maybe the results of the research were not something that was, worth publishing, but it doesn't mean that you didn't go through the motions of thinking about something, getting IRB, and those are all really important things. And so if you participated in research, you should mention it. And maybe it's at a stage where you're still in it and it's not ready for publishing, but it will be in a year. So it doesn't. The final product doesn't have to be a manuscript in a publication in a peer-reviewed journal. Things that are in progress, things that you've worked on, are all still very important.
And there are sections for that also in the ARIS application, and it will ask for research experience. And so it's very easy to list what you have done, just as far as the lab that you worked in or the mentor that you worked with. And that is a separate section from publications. And so when we're reviewing the applications, we always look at that to see the research experiences that you've had. And even in the publication section, you are able to say, for instance, submitted. So if there's a manuscript in preparation, so you're able to denote those differences, because yes, absolutely. By the time you're applying, a lot of times most most of those things, especially if you started doing them this past year, are not actually published. And so those are essentially bulleted points that we can read and ask you about. So during the interview, so you're able to really fully explain your participation in the project. And I think for sure the presentations, because a lot of times there will be upcoming presentations. In other words, on the application, you already know that you were accepted for a presentation for a meeting in the fall or in the winter. We know about that acceptance many months in advance. And so that is something that should be listed there, even if you haven't actually physically done the presentation yet. And if it got canceled for COVID, that's just like a little parentheses side note that you include there.
Thank you. So we had another question in regards to research and CVs. They wanted to know, is it worthwhile to include the research significance or impact factor on your CV? This person says that they have publications with a high impact factor, but they don't have a high volume of publications.
I think most people who are reading your CV at this level, if you publish in Nature, you don't need to tell us what the impact factor is. We know what that is. We know what the New England Journal is, and I think we know what a throwaway journal is. So I don't think that you need to include. You have to include the name of the journal, of course, but I think we all recognize what impact different journals have.
And it's also not the volume of publications. Certainly, if you have an authorship and a publication in a very high impact journal, that is plenty. So, and we all are very well versed in that. So that is not something that necessarily needs to be pointed out, and that might carry more weight depending on what program you're looking into and how they're viewing your application. All programs look at that very differently.
So we had another question. We actually had several questions. Earlier when we were talking about CVs, we talked about don't leave gaps, but many students said that they actually do have gaps, and how should they address those gaps that they had for whatever reason, whether it be financial, having to go out of the country, etc. They can't go back and change time. So what do they do about it now?
I think just be honest and be truthful. If it's like a 2-month gap, then it obviously doesn't matter. I think that the gaps that we're talking about are, 1 year, 2 year gaps. I would say a gap of several months is not anything that anyone is going to even notice or think about. But if you graduated college in 2002 and then you went to medical school in 2005, and you don't say what happened between 2002 and 2005, whether it was working or traveling or what have you, I think that would be something that we would notice.
And again, in the ARS application, there are spots for that too. So it asks for work experience, and those are you have the opportunity to list that there. So you can in the ARS application, it should be clear to someone who's reading it if you finished medical school or if you finished college and then took time off. And we see that very frequently. So there are many people that worked in a different field or did consulting. And again, those are those experiences that you write about in your personal statement, and it just reiterates what you were doing during that time. And I think all of us really do value the fact that not everybody follows a traditional path, and that's okay. But it is important to explain what it was that you were doing during that time.
So speaking of jobs, especially non-medical jobs, we had a couple of questions about should you include those? I know Dr. Chang, you talked about how important that is for you to see as a program director, but what about people who had multiple short-term jobs? Is it important to include all of those? Could that look like a negative? What would you do in that case?
I guess I would kind of take it on a case-by-case situation, but I think if you've had multiple short-term jobs, like a few months here and a few months there, I wouldn't list all those. I certainly, if you worked in the biotech industry for, a year as a consultant, that I think that's important. And I think it says something about who you are. If you had, for instance, throughout college, I worked at the Gap, and I did different things throughout college, and I didn't list any of those things. Mostly because I had also had other jobs. And so really what it is, were those experiences meaningful? Not really. And since I had other jobs that I could list, I didn't have to list every single little tiny thing that I had done. So that does take a little bit of massaging. I wouldn't list everything.
I agree with that too. I think it's a matter of just sort of editing, and probably when you look at that sort of big grouping, you should be able to figure out maybe the best way to sort of keep it short and sweet in some ways, without again, I think with being honest probably is the way that I would look at it. So you want to look at your past experiences and be honest about what you were doing with that time, because there is a possibility that you'll be asked about it. But I totally agree that you don't need to list every small, 2-month or, weekend type of job. And again, you want it to sort of add to the cumulative picture of your CV.
Great. So just to incorporate some of our personal statement questions that we received, somebody wanted to know, do you have advice for how to walk the fine line of showing what about that field draws you to it without just telling an expert the pros of their own field?
I guess it is a fine line, but, I've never really thought about it like, oh, you're already telling me something that I know, because it's your own, those are your own thoughts. That's how you feel, and that's how you really were drawn to the field. And we all know why we all want to go into surgery. Trust me. Like, I know why you guys are all listening. If you run across any other surgeon, you will all have the same feelings about surgery. Otherwise, you wouldn't be doing this. And so while it may not be something, it's not like it's going to be earth-shattering to me to read your personal statements like, oh, I never really thought about that. It could be, but probably not. But that's okay. That's what drew you to surgery, and that's meaningful, and it's important. So I wouldn't be afraid that you're saying something that I already know. Because what I don't know is who you are.
It is a shared experience. I think that's why most of the personal statements end up sounding pretty similar, is because it is common why we decide to go into the field that we go into. So, and I think that's okay.
All right, so we have time, it looks like, for one last question. So on the topic of CVs and personal statements, what sorts of traits and skills do you like to see highlighted for a surgery applicant, and why?
So I think things that are important are maybe attributes that we're sort of looking for are things like teamwork, collaboration, those sort of personal attributes. I think what we often see that is very common is sort of interest in like manual dexterity, which is something that comes up very frequently in personal statement. Why you might enjoy doing actually surgery, and that also I think is okay as well. I think that what we maybe sort of the things that we don't want to see are where people are trying to think of the best way to put this. I think what we don't want to see in that personal statement is that people are overly confident and as far as what they are actually offering. So I think part of what we're trying to do is really make sure that that the program itself fits with the personality. That's ultimately what we really want as program directors, because we really want residents that are going to come and be very happy that they're actually there. What I want on match day is for all of the residents that matched into our program to be so excited that they ended up at their, at the program that they really wanted to go to. And so that's what we're really trying to get from the personal statement. And it's different for every program because there are things that are maybe subtly different just about the culture of the program. And so that is what we're actually looking for, but it's probably going to be different. So I think really kind of being honest about who you are is, again, the most important thing, because you want that to come through with your personal statement.
Yeah, I'd agree. We're looking for those same things: teamwork, collaboration. The other things that you could think about are perseverance, grit. Those are also things that I think we think about. Leadership. Those are characteristics that that some of us have some early experiences, and you can showcase that. So those are some good character traits that I would maybe do some introspection of who you are and where you excel, and talk about those things. And they may not be all of those things, but certainly, undoubtedly, several of them are applicable to who you are.
Well, thank you both so much. Do you have any parting thoughts that you'd like to leave the students with?
I guess I would say, I think we've said this a bunch of times, but be honest. And I think what Dr. Gray was trying to say, don't be arrogant. And share something about yourself. Make sure you do your CV and your personal statement early, actually, because when you ask for letters, your letter writers will want to see them before they write a letter. So when I get asked to write a letter for someone, I usually say, send me your CV and your personal statement. And so this is maybe what that other person was talking about, a paper copy, right? A PDF or a Word document. So you will be sending your CV not to a program, but maybe to your letter writer. And so that perhaps is more applicable about the colorful nature. But I would stick with black and white, make it really easy to read. And letter writers will oftentimes use those documents to help them write their letter, and to make sure that they write a very meaningful letter on your behalf. And there are probably things about you that they know that don't come from your personal statement and your CV that they will write about, but there are probably things about you that they don't know until they read that, and then that is just it will make your letter more impressive when they can include all of that and summarize it in a meaningful way that makes a difference to a program director. So I would actually make sure you have those things before you ask your letter writer to write a letter for you.
I agree with all of that. And I think the other thing, just specifically for this year, again, is that we really are all going through this complicated time together. And as program directors, we are trying to figure out how to reassure students. We're trying to figure out how to let people know about our program without being able to have visiting clerkships, and with the thought of doing virtual interviews. There are just so many. We are also dealing with the stress of that too. So we know how stressful it is for students. And again, everything we're trying to do is to try to make it actually easier for students and less stressful. And unfortunately, I think we're going to go through some growing pains where maybe things that we're offering, like more, webinars and more opportunities to visit virtually. I was just sort of talking to some students recently, and now they're feeling like they have to sign up for every single webinar, and then they're thinking, how am I going to study for step 2, and how am I going to do my application if I'm on a million webinars for every single otolaryngology program across the country? And that is obviously not the intent. So I think we will all learn how to do this well as we're going through it, and we really do want to support the students during this time. And hopefully we'll be able to do that. I really do think sort of leaning on mentors at your home institution is probably the way to do this, because they're going to really be able to help you look at your application, reassure you about the strengths, and if there are any issues that you need to actually address. So I think the more that you're able to do that, the more confident you should feel going into this. And it'll be fine. That's what I always say to my residents about everything. It's all going to be, it'll all be fine. It's just going to be a little different this year.
We're actually just as stressed out as you are.
It's true.
Well, thank you both so much. The AWS Medical Student Committee would like to give a warm thank you to all of our amazing program directors, Dr. Sprazzle, Chang, and Gray. We really appreciate your time and your expertise. Students, we appreciate your attendance too, and we really hope that you found this beneficial regardless of your year in medical school. If you'd like to rewatch this or show it to your peers who could not attend, this webinar has been recorded and it's going to be posted to our YouTube channel. So you should be able to see that by tomorrow, hopefully. And you can always access that in the future. Before I conclude the call, I want to tell everybody that we've opened our call for abstracts this year for AWS's Research Symposium. This year, we're hosting an online multi-round research format with visual abstracts, oral presentations, and more. So it's called AWS Research Madness, Road to AWS 2020. You can check it out on our website for more information, and the abstract deadline is June 26th. I've also dropped the link in our chat right here in the Zoom call for Research Madness, as well as a brief survey if you are one of the students applying in this application cycle. So I believe that concludes our call. Thank you all so much, and I hope you have a wonderful rest of your evening.
Thank you.
Thank you.
Thank you both so much. That was so helpful.
Oh,
I'm so sorry I could not get in initially. That was